So it's a pleasure to be involved in the primary care leadership collaboratives here in the east of England today. I've had a number of key messages that I wanted to share with the people who attended. The first, and for me the most important, is recognizing that staff who are working in the NHS are under enormous pressure. That what we see is somewhere around 40% of staff reporting that they've been unwell as a result of stress at work during the previous year. And that's a real paradox, that we are damaging the health and well-being of a large proportion of the staff who we ask to promote the health and well-being of others. So we have to focus on the underlying issues which are causing these problems, and at the same time to promote high quality, continually improving and compassionate care. And I think it starts with compassion. So compassion is about listening to the other person with fascination. It's about understanding the challenges they face. It's empathizing with them, and then it's taking intelligent, compassionate action to help them. And if we are to create compassionate, high-quality care cultures, then as leaders we have to embody compassion in our leadership. That means we need to listen with fascination to those we lead, to understand the challenges they face, to empathize with them, and then to take action to help or serve them. And when we create those conditions, then the care that patients receive will be more compassionate, and our staff will have better health and well-being also. The other thing we have to do as leaders is to ensure that there is clear direction, that there's alignment of efforts around that direction, and there is commitment of staff. That means we have to be really clear in our primary care organizations, dental care organizations, about the core inspiring vision of the work we're doing, and that as leaders we embody a focus on that vision in the way we lead every day. And second, we have to ensure that everyone is clear about what it is they're required to do and how that is aligned with the direction of our organization. So that's making sure that our primary care teams, other organizations, have simplified what it is that the organization and people are required to do. So making sure we've got 5 or 6 clear, agreed, challenging objectives in every team at every level in the organization, and making sure that every individual also has agreed a limited number, 5 or 6, clear, challenging objectives. And that helps to ensure that there's both role clarity and it deals with some of the problems of work overload. The third is making sure that we are developing the commitment of people who work in our organizations. And that's about leaders ensuring that they model authenticity, genuineness in the way they lead, that they're open and honest, that they also have humility, that they're always asking the question, how can I be a better leader of their staff? How can I, what should I change to be a better leader? Ensuring that they're optimistic, that they show gratitude and appreciation, recognition to those they lead, and of course that they're compassionate. The fourth important area for leaders to focus on is encouraging innovation. And compassionate leadership creates the psychological safety where people are more likely to raise issues, raise concerns, acknowledge errors, which is the beginning of the innovation process. So compassionate leadership is key to creating that psychological safety, which leads to discussion, exploration of views, and thereby innovation. And it's also ensuring that we're creating organizations where there isn't command and control leadership, rather there's much more collective leadership, where everyone feels they have leadership responsibility, where there's shared leadership in teams. We may have a hierarchical leader of the team, but he or she is concerned to bring out everybody's contribution. And where there's interdependent leadership, where leaders are working together to prioritize patient care overall, rather than just focusing on their individual areas of responsibility. And the final area that's really important is getting team working right. That's making sure that there is an inspiring vision in teams, that people are working in positive, supportive, collaborative ways, that there aren't enduring interpersonal conflicts, that conflicts, when they do arise, are dealt with openly, quickly, supportively, and in a compassionate way. That most importantly, that teams are taking time out on a regular basis to review what it is they're trying to achieve and how they're going about it. Simply continuing to spin the hamster wheel faster and faster is literally counterproductive. We know from abundant research evidence across many, many studies internationally that teams that stop, debrief, pause, reflect, take time out, half days, away days to review what they're trying to achieve and how they're going about it are on average 38% more productive than teams that don't. So it's fundamental to creating effective teamwork for the delivery of high quality, continually improving and compassionate care. But what's really important also is that those who lead teams and organizations in our health services look after themselves by making sure that they're promoting their own well-being through having good quality time with the people who love them and who they love, and having sufficient sleep and exercise and being present in life, and also making sure that we're creating the conditions where we can continue to learn and grow. So compassionate leadership is my fundamental message, but also in order to have the resilience and the capacity to be compassionate as leaders, we must first be self-compassionate. That means paying attention to ourselves, understanding the challenges we face in our work and indeed in our lives generally, empathizing with ourselves, caring for ourselves, and then taking intelligent action to help ourselves in order that we can be who we can be and stay close to the core values that give our lives meaning, like compassion, and enable us then to have deeper and more authentic connections with those we lead and indeed with everyone we interact with. So it begins with self-compassion. Thank you.